Hey guys, Lauren here with Bizrok. In this week's video, I want to talk to you about a best practice, which sometimes isn't always our favorite best practice to talk about, but it is so important to running a successful practice. And that is the new patient packet. Now, for some of you, especially if you've never done training or gone through communication and language training with us before, you might be like, wait, is that the same thing as the new patient paperwork? The short answer is yes, but I want you to hear kind of the verbiage that I said. I said new patient packet instead of new patient paperwork. So let's start there, shall we? So whenever you hear the word paperwork, what do you automatically think of? Typically in our trainings, whenever we ask team members this question, they're like, ugh, homework. They're like, I feel like it's gonna be homework and there's gotta be a lot of paperwork to fill out. So one, there's a play on verbiage there. So you might say new patient packet instead of new patient paperwork. One, just because it seems and feels a little more appealing, okay? So let's start there. When a new patient calls to schedule for their very first visit with you, guys, we're in a whole new decade where technology is everything and you've got to be leveraging your technology. You want to make sure that you make your life easier, not harder. So hopefully your practice management software has some sort of technology feature for it. If not, guys, it might be time to upgrade. But hopefully there's some sort of technology component where you can automatically send out patients their new patient packet ahead of time. But guys, give them a heads up. Hey, Susie, new patient, we're so excited to see you on this day at this time with our team. Tell them about the experience. You're gonna have such a great day and here's what to expect. To prepare for your visit, we are gonna send you a direct link to our new patient packet. It should take you about 10 to 15 minutes to complete, so we do ask that you fill that out before your visit. Otherwise, we ask that you show up at least 15 minutes early for your appointment so that you can get all of that completed. Do you have any other questions from me? See how easy that was, guys? People are more likely to do it if you set the stage for them and you give them it far in advance. But people don't like surprises. So whenever you give them the opportunity to fill it out online, because for some of you, you're like, Lauren, I do that. And I send it to my patients in advance and they don't ever do it. One, you might not be setting the stage right. You might not be telling the patient. And guys, we're storytellers. And as patients, we are the first ones to say, oh my gosh, I don't want to fill that out. It's probably going to take me 30 minutes. Guys, educate your patient. It's also okay to say, depending on how extensive your medical history is, it should actually take you about 10 minutes, which is super quick. There's a couple bullets just to fill in, but our system's set up so that it's quick and easy to fill out ahead of time. See, you've got to educate them on the front end if you want them to complete it in advance for you, okay? So that's step one. And then step two is what needs to be included in that new patient packet, right? And I'm going to go through these because I would say probably 70 to 80% of our practices, the first time we start working with them, they're missing one of these important forms. Now for you in your practice, you might have random specific ones that you absolutely need every patient to fill out. I don't know those, right? Those are custom for you, but I'm going to give you some of the basics that every single patient should always have in that new patient packet, okay? For starters, they obviously need contact information. This is about the patient, information about them. First name, last name, address, basic information, okay? You should also, and this is the one that always gets missed, so hear me out. You should also make sure there's a section on there with emergency contact information, making sure that there's a place, God forbid, guys, if something ever happens to one of your patients in the office, who do you call? Do they have a loved one, a spouse? Maybe it's a teenager. Do they need to actually fill out mom and dad's information or a guardian? Making sure that there's a section for emergency contact information. So that's typically the one that gets forgotten about. So we said basic patient contact information, emergency contact information, medical history. Guys, please put a star behind this because you should absolutely get medical history paperwork, like have it refilled out for your patient. The guidelines in the law is once every 2 years. I will say for us, our best practice recommendation is that you have patients refill out that information by hand, that whole sheet at least once a year. Guys, things happen. Things happen all the time and our medical history changes and sometimes we forget about it. So whenever your patients go through that step-by-step process of refilling it out, then it reminds them and it jogs them, oh yeah, I forgot I had this happen to me earlier this year. And 2 years from me personally is just, that's too long of a time frame. There's so many things that could happen in a person's life that we just don't want them to forget about. Again, the law says 2 years. However, my personal recommendation and the Bizrok recommendation is once per year. Now, that doesn't discount the fact that at every single appointment, we should be asking every single patient, are there any changes in your medical history? Are there any changes? And then we document that in their notes every single time. Even if we saw them yesterday and they're back for another appointment today, are there any changes in your medical history, okay? I digress, but I think that's super important. So we've talked about basic contact information, emergency contact information, medical history, put a star by that. The other few that typically get forgotten about, obviously you guys need a HIPAA form. So making sure that that information is listed out for your patients to read and sign as to what you guys do with their information. It's super, super important to make sure that they have that information ahead of time. A financial policy. I know most of you have a financial policy. If you don't, please reach out to us because you need one. But you need to have your patient sign some sort of financial policy. It's a reminder that whenever we file their insurance for them, it is a courtesy. And even if their insurance doesn't pay, guys, it still goes back on the patient. But if you don't educate them on that front side, if you don't disclose that on the front end, it makes it a really hard conversation for you to have with the patient. So make sure that you have some sort of financial policy that talks about your cancellation or no-show policy, discusses how you handle insurance, and again, a reminder to them that it is a courtesy that we file claims on their behalf. And then any other financial policies that you have. For some of our offices, they collect a deposit whenever they're scheduling. Some of our other offices, they require everything to be paid up front before their visit. Whatever works for your practice, whatever your doctor's policy is, that needs to be in that financial arrangement. Last couple ones, if you are really involved in social media and you want to take a lot of pictures of patients, have a photography release form. It's okay to have that. It should be short, it should be quick. It might even be a half sheet, which means you can probably merge it with your financial policy. But those are a few things that you absolutely want to have. The last form that I want to talk about that I would say probably 90% of the time is forgotten about, and that is who is allowed to have access to that patient's information. Mom and dad's listening. If you have teenagers or college-age children and they're in that phase of life where they're like 17 to 26, and maybe they're still relying on you to pay their financial bills, including their dental care, and they might even be on your insurance. I want you to pay close attention because sometimes those are the patients that they don't have a sign off for mom and dad, or the teenagers trying to fill out their paperwork and they don't think about or remember to include mom and dad, which does put the liability on them. And so if you are a mom or a dad or you have a teenager, put yourself in their shoes. Wouldn't you want to know that information? Wouldn't you want to make sure that your son or daughter filled that out? So you've got to have that information in the packet, okay? The other people that are often forgotten about in this are the elderly population. Typically the couple that's in their 70s, they're just not thinking about it, guys. And so if you've got the husband in the office by himself and he's filling out his paperwork, and you're 100%, you're like, he's married and usually his wife comes with him. I don't know why she didn't today. It is okay to say, hey, Mr. Jones, I know that your wife typically comes with you. I didn't notice her on your paperwork. Do you want to include her on this so that she's able to have access to any of your dental information, or do you want to keep her off of this? Simply by asking it is okay. Or say, is there anybody else that needs to have access to this? This is where their caregivers have to be included. Otherwise, guys, you are not allowed to disclose any of that dental insurance or dental history to another patient. And here's where it's really important. If there happens to be a medical emergency with that patient in your office and you don't see that there's any sort of emergency contact information or release of medical information, this is where it's really sticky. So we're trying to share this with you so that we help protect you, so that your patient has an amazing experience with you, but God forbid you need that information. You can always go back onto their patient paperwork or patient packet, and you can review that ahead of time, okay? If you need help, guys, we've seen patient packets that's like 12 pages long, and I'm like, okay, that is too much. Let's make the patient's life easier, not harder. So if you need any help, reach out to our team. We'd be more than happy to help you and review that with you and see how we condense it. Otherwise, guys, as always, our team's here for you, and we can't wait to see you and serve you soon.